Hello, my name is Michele Pitts Brown, consultant and advocate supporting the needs of individuals and families affected by developmental disabilities. Some are visible while others are not quite as visible. Today I want to talk about Medicare versus Medicaid, to talk about some similarities and differences. Okay, now, as parents advocating for the needs of our children, you know that a lot of the services that we try to secure, they cost money. So knowing what insurances are available and how to access them is pretty important. Let's look at Medicare. Medicare is a federally funded program that covers medical and outpatient expenses for individuals with a disability. Some of you only think that it may cover retirement, and although that is true, yes, there is a portion for the disabled. So it is critical that if you have not already applied for Medicare and you have a recognized disability by the Social Security Administration, it is pretty important that you go ahead and apply for those benefits. Now, Part A of Medicare covers inpatient, which is hospitalization or hospice services. Part B covers outpatient medical expenses, and Part D has a prescription drug coverage plan. There's also a Medicare Advantage plan. Federally funded programs in this country, in the U.S., pretty much, the services are nationwide, and that is true with Medicare. The program is applied consistently over the 50 states. And if you want to have more questions answered, I actually have a hard copy of this book, but it's not necessary for you to do that. You can actually go online and get this same information. It's a pretty long book, but you can get more specific questions answered, and it will also prompt you to apply for the benefits if you have not already done so and you feel that you may qualify. Okay, so let's move on to Medicaid. Medicaid is a state-specific program. Both plans pay for health care services, but Medicaid is state-specific. Medicare, you can use that coverage throughout the country as long as you don't leave the country. You can, they will cover costs that are approved. You can use it in any state in the country. Medicaid, the difference is, although it'll pay for health care costs, it has to be state-specific and approved by the state. So that's the big difference there. If you move to Michigan from Virginia, then you need to apply for Medicaid in the state that you're moving to, because that benefit will not carry over into the new state that you move into. All right, but the wonderful thing about Medicaid is that it covers case management. If you're in a long-term care program, it covers all types of inpatient and outpatient services, and if you're in a long-term program, it can even cover some respite care. So it's a super program, and you need to make sure that you check with Human Services or Social Services in your state to make sure that if you are eligible or your loved one is eligible for the benefit, that you go ahead and apply for it. So I hope that was helpful information. I cannot answer all the questions about Medicare and Medicaid in this short clip, but I certainly can direct you to go to your either state website for Medicaid or medicare.gov and go ahead and electronically download and read information on Medicare benefits and apply if you haven't already done so. I hope you found that information helpful. You have a great day. See you next time. Bye.